Neffet's advice is in, so what should the government do? Well, we've lots of views here in the studio tonight. Nigel Farage campaigned long and hard for Brexit. He's got it now, and I'll be asking him how he thinks things are going as UK supermarket shelves lie empty, fights break out at petrol stations and tensions rise in Northern Ireland. Mealworm burgers are on the menu here with me and Paddy Cole as the guinea pigs. We'll taste the future of food with the help of chef Gary O'Hanlon. Welcome to Claire Byrne Live.
It's been a nightmare, you know.
I didn't say it was crazy. I said it hadn't been thought through.
An entire generation that feels left behind.
Who's calling the shots here?
There are really difficult choices to be made here.
You're a bad person. Get back into that corner.
I never thought the violence would end.
Partition has a cost.
We are British.
Because we are two races, or one.
We should be on the same side.
Hello and welcome to the programme. Now, I say that Neffet's advice is in. We just don't know what the advice is because we're waiting to hear from government buildings tonight. We know that Neffet is meeting members of Cabinet tonight to explain to them what they've decided, but it's very hard to get a handle on what might be going on. Gabby Gadovitz-Gaitha from the Irish Independent is here. Will you just tell us what you know about what's going on tonight?
Yeah, so it's been a long day, I suppose, in government buildings. We saw a NIAC meeting this morning talking about booster shots, what's next for the vaccination rollout, and then you're right, this afternoon Neffet did met for several hours, you know, to Dr. Tony Holohan and his team to consider the very latest data in regards to the cases, the numbers in hospital, and write a letter to Minister for Health Stephen Donnelly.
So that meeting took a couple of hours this afternoon from 2 o'clock.
That's right.
And then what happened?
And then the letter, of course, was written and sent into government buildings. And now this evening, as we're speaking, the three party leaders, Taoiseach Micheál Martin, Tánaiste Líamh Varadkar, Green Party leader Eamon Ryan, they're meeting and they're going through what's in the letter and they're discussing what steps to take next. Now, I think what's important this time around, because we've done this many times now, this jig of we have the Neffet advice, what's next for the government, what will the ministers do? What's crucial is that the Cabinet subcommittee on COVID-19 is not meeting. That used to be the step before the full Cabinet meeting. Tomorrow morning we will have the full Cabinet meeting, but because we don't have that subcommittee meeting where you have some of the most senior ministers come into the room, discuss through their restrictions, that's kind of the missing step, I suppose, this time around.
So tonight then you've got the three party leaders meeting with the letter from Neffet. They're not meeting with the CMO, are they? Well,
they're meeting to discuss the advice and what's in it and how they should proceed. You're going to have that full Cabinet meeting tomorrow morning where all ministers are going to come in, sit around a table and say, right, what is it that we do next? So I suppose tomorrow's going to be a really big day for government. And, you know, the significance of the subcommittee COVID-19 was that it was actually, you know, some ministers would have already done the work, so to speak, before full Cabinet met, and they would have agreed on things like dates and what do we kind of do next, and then Cabinet maybe, you know, iron out some of the remaining issues. But it'll really be tomorrow a full decision to be made. What actually do we do on Friday?
So what are the big things at issue then tomorrow?
So, of course, the biggest question is around the COVID certs and what happens next with them. We've gotten very clear indications from, you know, both senior sources in government and even the Taoiseach himself today that those COVID certs for hospitality, for cafes, bars, restaurants, they're not going anywhere. What's on the table currently still is, can we reopen nightclubs on Friday like we were supposed to, but with those COVID certs in place? Now, past Friday, the COVID certs were supposed to be completely gone. Also things like, you know, increasing numbers attending at weddings, funerals, religious services, outdoor, indoor gigs, things like that were supposed to come into question also.
And have you heard anything about what Neffet may have said in that letter tonight to government?
So we did see Micheál Holohan reporting on the news that, you know, they may have recommended a full pause of restrictions.
So no change on Friday?
So no change, but that's not, you know, we're still looking to see, I suppose, as things evolve over today and tomorrow.
Because one of the other big issues at stake here for many people, and this is really important, not just for the businesses who run weddings, but also for the couples who are getting married, there was supposed to be a big change on Friday when it came to guest numbers.
Yeah, of course. Like pretty much all of the restrictions were supposed to be lifted on Friday, bar mask wearing on public transport, in healthcare settings and in retail. But really, that's been thrown into disarray because of those rising COVID numbers, the high cases, the high numbers of cases that we're seeing, numbers in hospitals. And, you know, government now is really afraid that, yes, we're seeing this remarkable vaccination drive, so many people vaccinated, but can our hospital system actually handle those high numbers of COVID patients?
OK, Gabby, well, we have lots of people here who have plenty to say about all of this. I want to come to Buzz O'Neill first. Buzz, you're very welcome. You're a club promoter, people may know. I know you've been talking quite a bit about having to remain closed for 19 months now. And I'm sure that you have been watching and waiting for news all day today.
Well, not even all day. I mean, August 31st, this was announced. So let's be honest, we've been waiting since then, and we've been waiting for some sort of guidance from government. We've been waiting for a plan. We've been waiting for any sort of hint as to, you know, how we were going to successfully and safely reopen our businesses, you know. They've known about this for months, you know.
Would you have expected to know tonight what might have been about to happen on Friday?
Yeah, but, you know, as you say, I've been banging on about this for a very long time, you know. We wanted to know last week, you know, we want to know are we opening? How do we staff our venues? What are our numbers? What are our restrictions, if any? You know, a lot of promoters like myself and concert promoters and music promoters and event promoters wouldn't have put tickets on sale for this weekend if we thought there was any sort of hint of the numbers being restricted. We need, and it's not that we want, OK, we need to open. And we want to open safely, OK? Because we want to get our businesses back open. Well,
Art is here as well. And Art, I know you were planning a music festival for this weekend. Is that right?
Absolutely. And I concur with what Buzz has said. I think everybody wants to move forward in a safe fashion. I suppose from our perspective, and it comes right from the middle of Dublin to a small town in Kerry, we're planning a traditional music festival that's meant to take place from Friday until Monday. Now, that was based on the assumption and with the advice of government agencies from the Arts Council, the Department and everybody else who've all engaged very helpfully, that we could go ahead with capacity based on, I suppose, what Gabby said, that we were going to be in a very different circumstance. It's now Monday night. We're expecting a decision tomorrow for Friday to tell people whether or not they can attend, whether or not they should come down. And, you know, in a small town in rural Ireland, Castle Island, this is like losing Christmas.
Yeah, I just wonder, you know, because there's all this talk about what might happen, does that add to the nervousness? I mean, even if you're allowed to go ahead, will people come? That must be on your mind as well, is it?
Absolutely, and I think there's a concern among business people who, I suppose, in our case, we have only 7 or 8 pubs in the town. One of them opened specifically for this weekend based on the fact that this was, I suppose, the economic benefit that we're going to get. People might decide not to come based on, I suppose, the lack of communication that's been given from government. But also there's the genuine concern that I suppose, what we've printed and what we've told people is going to go ahead might not.
Well, Elizabeth is here as well. Elizabeth's down the front. You're very welcome, Elizabeth. What is it? You just want clarity, is it?
Hello, Claire. Well, a couple of things, really, on a slightly different perspective. Yes, clarity and... OK, 18 months ago we were all in the dark. 12 months ago we had a lot more data, and I still feel that there's been a caginess about the level and the detail of information being given to us as a nation. And I feel like when we have a mix of the NEFIT, but we don't get the messaging we get on shows like yours and other medias, like from Prof O'Neill and Paddy Mallon and Professor McConkey, and it doesn't seem that all of that information is assimilated. And I think the one thing we shouldn't do is start to divide and segregate, that we really are all aiming and chasing the same thing. And I think the government do need to give us some clarity. But if I can just make a really quick question. I live part-time in New Zealand, very little, and I got locked down in New Zealand last year. I was there 3 days, couldn't get out for ages. I got back, I'm meant to be there now, I can't get in. But as of today, just to put a context on how much better off we are here in Ireland, and that people can understand actually how well we've done, because it's easy to criticise. In New Zealand, there have been a total of 28 deaths as of about 2 hours ago, just over 5,000 people who got COVID. Auckland is now being continued in another lockdown for another 2 weeks, and people are ready to revolt. Now, I have underlying health issues. I'm 57 years of age, and 3 weeks ago I got called for my first COVID shot in New Zealand. So actually, if you put it into perspective, I think we've done very well here. Who would want the job of anybody in government? I think we really all need to just hang in. I know it's like patronising, but we do need to hang in another little bit. And if the government could just be more clear and concise and talk to us as an educated nation that we are.
OK, Darren McDonough is here. Darren, you're very welcome. What do you think should happen?
Well, I think that it's very important that we go for as full an opening as possible and maintain those COVID certs. And actually, I think not only just maintain the COVID certs, but start introducing them in more places to push for full vaccination. I don't understand why we're not checking certs on the doors of shops, supermarkets, offices. You know, we have, as a nation, we have come out really well in support of this vaccination, 90%. And we're not going to see that number of 370,000 dwindle until we come down harder on the COVID certs.
So open up, but use those COVID certs everywhere. And you're nodding, Buzz, there in agreement as well. I mean, I know that your industry wants to see the use of COVID certs if it means you can open the doors.
Yeah, absolutely. And when we called for this, but we also at the same time as well, you know, we've called for another step further. You know, again, we keep trying to hammer this home, especially when we're talking to government all the time. You know, what we do is run events for a living. And, you know, health and safety and all those issues are bread and butter. You know, we live and die by those. Obviously, maybe not the best phrase to use, but we do. So we want to run as safe a possible event as
So whatever
this.
it takes.
So not even that. There are many things that it can take, and we want to roll those out. You know, there are papers, there are reports sitting on government ministers' desks, gathering dust for the last 6 months about antigen testing, and hallelujah, praise the Lord, all of a sudden the Taoiseach today is blathering on about it. We were on about it 6 months ago. This is not just a revelation for him. You know, you could be having antigen testing alongside COVID certs as well. How safe would that be then? You know, absolutely nobody that would come into your venue would be testing positive.
Well, Darren Lawler, who's sitting here behind me, you have a different view on all of this, do you?
Yeah, I think we need to pause, Claire. I don't think we should open up too soon. We made that mistake last Christmas. Many people have died. Many people have got sick. People are letting their guard down. People are walking in your shadows now when you're in the shops, whether you're in work, in shopping centres, and they're not wearing the masks properly. The vaccine is a very important tool in relation to helping us maybe not getting too sick with COVID or ending up in ICU.
But you still run the risk, is what
you
what
still
you're
run the
saying.
risk, you know. So if we kept the masks on, wear them properly, and if we kept our distance, we have a better chance of not getting COVID.
You were chatting to us before on the programme, and COVID has taken a very heavy toll on your family.
My dad passed away on the 5th of February with COVID. The week before that, my mum, 2 weeks before that, my mum was taken to the Mater Hospital. They were both critical at the same time. My mum was given 3 days to live. As soon as she started slowly pulling out of that, my dad was taken in and he passed away. You know.
How is your mum doing now?
Well, we have 5 tanks of oxygen in the house. Where we bring her everywhere, we bring the oxygen with us. She's getting more scans tomorrow. She's developing ulcers on her leg. She's in hospital for over 2 months. So it's taken a toll on everybody, the whole community, not just my mum and my family.
I wonder when you hear people saying, we have to open up, we have to do it now, we have to do it on Friday. Are you thinking if you saw what I saw, you'd have a different view?
Claire, we just have to pause. We have to reassess. Of course, businesses are suffering. I'm suffering as a business. I work for myself. I had 1 day's work last week. I'm on the COVID payment. So if we're going to open up, we have to open up safely. But the message is very clear. Wear the mask, keep your distance and wash your hands. I was up shopping on Saturday, and I won't mention the shopping centre, I think it was Saturday. And we went into one fast food restaurant and all the staff behind the counter had their masks on below their chins. The person checking your COVID cert had their mask on below her chin.
So you think people are getting lax?
They're getting lax, they're getting complacent. People are tired, but it's easier to take these precautions now than end up in ICU.
OK, well, Darren, we're going to take a look at a poll now, because earlier today we asked 1,000 adults on our Morg smartphone panel this question. Let's take a look. Do you think the government should go ahead with its full reopening plan for the 22nd of October, which of course is this Friday? Let's take a look at the results. 39% say yes, go ahead. But look at that, 49% said no and 12% don't know. So a significant majority of 49% there versus 39 saying pause, don't go ahead. Caroline is here. Caroline, you're very welcome. You're here from County Laois, where you're involved with the Chamber of Commerce. What's your take on this?
Well, I think businesses really need certainty. Unfortunately, you know, the government haven't been making decisions in a timely manner, and businesses are wondering whether or not they can reopen. And in Laois and around the country, these businesses are investing in hiring staff, in purchasing stock, in ensuring their premises are safe for customers and their staff. and it needs to be done in a timely manner. Chambers
so
Ireland.
are you coming down on either side here, or are you just saying we just need clarity?
We need clarity, but we also need to have a cautious approach. This time last year, I think, we might have rushed into things a little bit too much. We want to be in a position where we can actually enjoy Christmas this year and still be safe. But I'd agree with what the Taoiseach indicated about continuing the mask wearing, the hand sanitising stations when we enter shops, and of course the checking of COVID-19 certificates in hospitality sectors. I think that's so important, and we'd strongly support that. But, businesses really need the certainty, particularly around sports as well. Budget 2022 was very disappointing in terms of the EWSS. Of course, that's being extended to the end of April.
Yeah.
But it's going to be tapered off. And what other supports are going to be available for businesses? For hospitality, for example, Q1 of 2022, we might be in a position where people are more comfortable travelling internationally.
Well, look, we're going to have to see, because you would assume that if things change and if the restrictions are either put in place again or if there's a pause press, that there's going to have to be an about turn on some of those decisions. So if something changes, everything might have to change. Caroline, thanks very much for being here. I want to bring you another poll now, because earlier today we asked 1,000 adults on our Morg smartphone panel the following question. Would you favour increased restrictions on unvaccinated people? Let's take a look at the results now. So there you see it. 69% say yes, they would favour increased restrictions. 24% say no, and 7% don't know. We're going to talk to immunologist Professor Christine Losher very shortly, but first we're joined from Cork by Joe O'Shea. Joe, you're in the 69%. More restrictions for unvaccinated people, you say. Why?
Because the vaccines are our only, at the moment, safe route, possible route out of a global pandemic. It's been 19 months. People want to get back to normal. We have 370,000 people in this country who are still unvaccinated. Now, the Irish Pharmacy Union reckons about half of these are probably anti-vaxxers. We have to start making life as uncomfortable or as complicated for them as they apparently want to make life for us for month after month after month going forward. So what you look at is mandates like they're introducing in France, like they have introduced in France, like they've introduced in Italy, that they will be introducing in the US very shortly, where, for instance, you have to have a vaccine cert to go into a workplace. That's public and private sector. Where you keep the vaccine certs for hospitality, for people who want to go into cinemas, who want to use amenities, public spaces. We have to start compelling people, because a lot of them seem to think that because it's not affecting me directly, because maybe I'm young or maybe I'm healthy, or maybe I believe some post that I've seen on Facebook saying Bill Gates wants me to get vaccinated so he can turn me into a robot, that we have to start making their lives complicated as well.
OK, you sound really angry with people who have decided not to get vaccinated for whatever reason that might be, that they've made that decision.
Yeah, I am angry, and I think people are angry because we want to get out of this. We want our lives back. We want to get back to normality. We want to work again. We want to see people again. We want to have a Christmas that we're not talking about vaccination rates or infection rates, but we're actually talking about our Christmas plans and meeting our loved ones. We want our families to be protected. We want our communities to be protected. And that's why there are no scientific arguments to be made for not getting vaccinated. I'm not a virologist, but the anti-vaxxers aren't virologists either. There's no debate, because you can't debate somebody who believes in a religious belief, almost a cult-like thing of, well, I'm just not going to get vaccinated, and I'm not going to listen to my doctor. I'm not going to listen to the overwhelming evidence and opinion of the world's leading scientists. You can't debate with them. At this stage, we're talking about almost hardcore cranks.
Yeah, but you're talking, Joe, then about forcing people to take a vaccine if they have decided, as they have a right to decide. They've a right to decide. Look, I don't want to take this for whatever reason.
Yeah, they have a right. They have a right to decide, and if they want to lock themselves out of society because they will not live up to the responsibilities that they should be facing, then yeah, they have a right to decide that. You can't force people. Nobody's talking about forcing people to take vaccines, marching them down to health centres, but you can compel people, or you can let them know that if that is the decision you take, then unfortunately we cannot have you in our spaces. We cannot have you with the risk that you pose to our society, to our people, to our loved ones. It's not forcing, but it is definitely compelling.
OK, I want to go down to government buildings now because I think RT's political correspondent Micheál Lahan is there for us. Oh, Micheál, I see you're not at government buildings, but thank you very much for joining us. Do you have news for us?
Well, I think what is becoming clear tonight, Claire, as those discussions are still going on and they are going to go on for some time yet, is that the NPHET letter, while it does urge a pause on that original plan, which was to lift nearly all those restrictions, those COVID-related restrictions on Friday, it does too, it seems, offer possibilities and routes to the easing of some of the rules that should be possible, it seems, if there is a rigorous enforcement of the health safety measures, things like mask wearing and those COVID certs, that this, I think, when it comes to areas like increasing the attendance at indoor and outdoor events, is a possibility. Also, some possibilities, it seems, maybe when it comes to perhaps extending the opening hours of bars and restaurants by a small amount. But the big question remains tonight, what does it mean for nightclubs? Is that a possibility? Maybe it is, and maybe ultimately it's something that is going to be a political decision that will have to be made tomorrow. OK, so we are still really no further on, Micheál, would you say, in terms of knowing what this decision is ultimately going to be post-Cabinet meeting tomorrow? Yeah, I think the decision does fall to Cabinet. It does follow that unusual step that you don't have that COVID committee meeting tonight, that all the ministers are going to be centrally involved in this, because this NPHET letter as well does warn of the risks, and it talks about obviously the rising case numbers. So this is a big decision for government if there are going to be slight changes around the numbers surrounding those who can attend indoor and outdoor events and maybe other things as well. It will come with a risk, and it is something that will be a political decision. But there is a route forward to make some slight changes, nothing of the magnitude or the order of what was initially planned for October 22nd, but some changes and some moves forward that perhaps wasn't expected within the political system earlier today. OK, so maybe not a full pause, but definitely we're not going to get what we would have expected maybe even 10 days ago on the 26th of October, or 22nd of October rather. Micheál, thanks very much for bringing us that tonight. As I said, Professor Christine Loescher is here. You're very welcome, Christine. Joe O'Shea there, fed up with people who he says are making this decision for whatever reason not to get vaccinated. He wants to see us using more of a stick than a carrot when it comes to those people. What do you say?
I say that I think we need to figure out what the problem is in terms of concerns that people have around vaccination, and we need to address those. And I think a really good example of where we've done that recently is with pregnant women, where there was huge concerns and very low uptake of the vaccine initially. And then I think with a lot of people speaking out, a lot of good advice and a lot of education, I think the uptake has increased. So I think some of the figures are very interesting. So out of that 370,000 people, 70,000 of them have had a first dose but have not come forward for their second dose. So I do think that they're a cohort of people that you can entice back for a second dose. Maybe they had AstraZeneca and they want to have a Pfizer second dose, and we've only just allowed that mixing of vaccines to happen. With the other 300,000 people, I think Joe mentioned that the Irish Pharmacy Union think that probably only about half of those are actually anti-vaxxers. So I think there's probably 150,000 people. And again, it's about trying to listen to concerns and try and use the education and the communication that we have to entice them. I also think with the vaccine certs potentially staying in place, some people may have been hesitant, said the vaccine certs are going to be gone very, very soon. If they're around for the foreseeable future, that may incentivise people to come forward, particularly people in the younger cohorts where we do have lower uptakes of the vaccine. Yeah, I know you've been talking to some of the students in your own university about this issue. What have you been finding out about hesitancy there? Yeah, so we've just decided in DCU to kind of have a platform for students being able to raise concerns. So 18 to 24-year-olds have a very low uptake at the moment because they were offered the vaccine last. They have lots of concerns around fertility. We saw last week around the footballers there was an issue about virility, and there was a lot of anecdotal evidence around menstrual cycles, which they also associate with fertility. So a lot of it is focused on what they consider to be longer-term effects. They're not very focused on potential side effects of the vaccines in the short term. They're worried about those things in the longer term. And I know you've covered this extensively on your own radio show, Claire, where we tried to, I suppose, talk about where the information came from that was misinformation and try and put things straight in terms of... So tell me now, when you're having those conversations and when you're involved in explaining why that is not true, are they listening?
Or is the stuff they're getting from social media more powerful?
I would say that there is evidence that people are listening. So if you consider where we were 3 or 4 months ago with young women and with pregnancy, the uptake in those cohorts has increased. And I would say that's very much down to it being highlighted as an issue. It was very clear about the information that women were looking for, and I feel that they got that information and it did have an impact. I think one of the things that we don't understand very well is if there are 150,000 or 300,000 people who haven't taken the vaccine, I don't think we fully understand what their concerns are. And I think that's the first port of call. They're already restricted in terms of their lack of engagement with indoor events because vaccine certs are in place now. If they continue in place, those restrictions on those individuals will continue.
What do you say to that, Joe? Christine saying that, if you sit down and explain, I think what you're saying is you're seeing results from engagement. And as you say, there's about 150,000 people, according to the IPU, who may be convincible.
Yeah, she makes a very good point, especially with groups like pregnant women, especially with groups like young people. But there is also a hardcore of people as well. And unfortunately, they're the loudest people, and they're very loud in social media. They're very loud in our streets. What we have seen in France, especially, is that workplace mandates have worked. In France, after Macron brought in these laws, and they were very, very strict, and they were very, very resisted as well by the media, by our politicians and by the public, the rate of vaccination went up significantly. So it definitely try and persuade, definitely engage. There are people with real concerns, of course they are. But we also have to start being a bit more serious as well about who we allow to be in our spaces if we're ever going to escape this pandemic. 50,000 new cases in the UK today. 50,000 in one day. We don't want to mess around with this.
What about mandatory vaccination, Joe?
No, I don't think anybody is seriously suggesting that, and I don't think it would be possible. I don't think it would be feasible. You can't force people.
Yeah,
what
but you
I'm
say
saying
that.
is, it's not.
Can I just bring you the results of our poll on that? Because we asked 1,000 adults on our Morg smartphone panel the question: are you in favour of mandatory vaccination against COVID-19? Have a look at this. 46% say yes. 42% say no, and 12% don't know. So Joe, it's a sizable figure. I mean, 46% of the 1,000 people saying, yeah, mandatory.
I'm actually shocked by that figure, to be honest with you, because I can't see, and how that would be possible. I don't think that's a road that we want to go down. I don't think there's any country in the world is thinking of going down that road.
I thought you'd be in favour of it, given what you said earlier on.
No, I'm in favour of, if people want to decide, then they decide to lock themselves out effectively of public life. That's what they are deciding to do. Okay. So I don't think you can forcibly vaccinate people. And of course, we're talking about people who have already taken 10 or 11, 12 vaccinations in their lives to date and didn't have to do all the research on that. And if they cut their hand open on a rusty nail tomorrow and were offered a tetanus shot, they wouldn't be asking to do the research on that either. You can persuade some people, but there will be a hardcore of people who for their own willful ignorance will not be persuaded. So what we can do now, what is happening, we're seeing around the world, is effectively saying, OK, but you cannot be in our public spaces. You cannot be in our lives.
Christine, I want to ask you about booster shots. I know NIAC was deliberating today on what should happen with regards to booster shots for the general population. What's your own view on it? Is it time now where we're all told to line up?
So the booster shots prioritised over 60s, and that should be they should roll that out as quickly as they can. If you look at the case numbers from the HBSC website over the last few weeks, the over 55s is where the case number is really increasing, and interestingly, they have a higher incidence of admittance to hospital. So some of those age groups, the older age groups, of the case numbers, there's between 15 and 20% of them ending up in hospital. So those boosters will actually solve that problem.
OK, but healthcare workers as well. I mean, they were amongst the first to be vaccinated. Surely if there is a waning effect, they should be done too.
Yeah, no, absolutely. And I mean, one of the things that you see in older adults who are getting more of the COVID and they're ending up in hospital is that potentially it's because they got AstraZeneca, which is not as effective against Delta. Potentially they were vaccinated early on and it's waning vaccination. But also people of a certain age don't have as good an immune response to a vaccine in general. So it's not surprising that case numbers are increasing. Okay. But certainly anyone who was lined up first for a vaccine, particularly healthcare workers and people over 60, booster vaccination has to be an absolute priority. It will actually address some of the issues that we're seeing with the case numbers at the moment, and particularly the hospitalisations. The highest numbers of hospitalisations for vaccinated individuals are over 55s.
Christine, thank you very much for coming in tonight. That's Professor Christine Losher now.